Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a gynecologic oncologist talking to a patient called Anna Pearson. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Miss Pearson. I've reviewed some notes from your recent checkup, and I see you've had some troubling symptoms. Could you walk me through what's been going on, in your own words?
Sure. I've been feeling really bloated lately, and it doesn't seem to go away no matter what I eat. And I have this constant dull pain in my abdomen, mostly lower down. I thought it might be indigestion at first, but it's been weeks, and it's just not getting better.
I see. Has the bloating or pain affected your daily life in any specific ways?
Yes, actually. I've noticed that I feel full very quickly when I eat, which is strange because I used to have a big appetite. Now I can barely finish half my meal without feeling stuffed. Also, I'm tired all the time, just this deep fatigue, even after a good night's sleep.
That sounds quite uncomfortable. Besides the bloating, pain and fatigue, have you noticed any other changes? For example, any changes with your weight or your menstrual cycle?
Well, I've lost a few pounds, but it was unintentional. I haven't been dieting or anything, and my periods have become a bit irregular. I didn't think much of it. At first, he figured it might just be stress.
That's understandable. It's common for these symptoms to be mistaken for something less serious. Do you have any family history of cancer or any major health issues that you're aware of?
Yes, actually. My mother was diagnosed with breast cancer when she was in her 50s. She's in remission now, thankfully. But, as far as I know, no one in my family has had ovarian cancer specifically.
Family history of breast cancer can still be relevant, particularly if there are shared genetic factors involved. Just to clarify, you haven't experienced any spotting or unexpected bleeding outside your usual cycle, correct?
No spotting or anything like that. Just the irregularity in my cycle timing. But I have felt some pressure in my lower back, which is new for me.
Thank you for sharing all of this. The symptoms you've described: bloating, feeling full quickly, abdominal pain, and fatigue are sometimes seen in cases of ovarian cancer, though they can overlap with other conditions too. Since you have a family history of breast cancer, I'd like to take a closer look at this to rule out any underlying concerns.
I see. So, what kind of tests should I expect?
To start, I'd recommend a pelvic examination so I can feel for any unusual lumps or tenderness. We'll also arrange for a transvaginal ultrasound to get a detailed look at your ovaries and surrounding tissues. This ultrasound allows us to detect any abnormal growths or changes.
Okay, that makes sense. And what would the ultrasound show exactly?
The transvaginal ultrasound can provide images of your ovaries, fallopian tubes, and uterus. It helps us see if there are any cysts or solid masses that could be causing your symptoms. Additionally, I'd recommend a blood test to check for something called CA-125, which is a protein marker often elevated in ovarian cancer.
I've heard of that test before. So, Does a high CA 125 level mean I have cancer?
Not necessarily. Elevated CA 125 levels can be caused by several benign conditions, such as endometriosis or pelvic inflammatory disease. However, it can provide us with valuable clues, especially when combined with the ultrasound results. If we find anything concerning, we may suggest a CT scan for a more comprehensive view.
I understand. And I guess I just want to know if this is ovarian cancer, what happens next?
If we do detect ovarian cancer, we'd first confirm it with a biopsy, which involves taking a small tissue sample. From there, treatment options typically include surgery to remove any affected tissues, and in many cases, chemotherapy is also recommended to target any remaining cancer cells.
All right. And how involved is the surgery?
It varies based on the cancer's stage and spread. Early-stage cancer may only require removal of the affected ovary, while more advanced stages might involve a more extensive procedure to remove additional tissues or organs affected by the cancer. We'd discuss the best approach for your case after the initial tests.
I appreciate you explaining all of this. It's a lot to take in, but it helps to know the steps.
Absolutely. I want you to feel fully informed. We'll proceed with these initial tests and meet again to go over the results and the best way forward. In the meantime, please feel free to reach out if you have any more questions or concerns. I'll do everything I can to support you.
Thank you. That gives me some peace of mind.
You're welcome, Miss Pearson. We'll be in touch shortly to schedule your tests, and we'll take this one step at a time.
Extract 2, questions 13 to 24. You hear a doctor talking to a patient called Mrs. Evans. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mrs. Evans. I see you scheduled an appointment this morning with a note that you've had a persistent fever. I know we just saw each other a couple of weeks ago for your checkup, where everything looked good. Can you tell me what's been going on?
Yes, doctor. It started out of the blue 2 days ago. I felt really cold, then the chills set in, and when I took my temperature, it was 38.5 degrees Celsius. I thought maybe it would go away on its own, but it hasn't. It keeps going up and down, and I have been taking paracetamol, but it only helps.
I see. Have you had any other symptoms alongside the fever like a sore throat, cough, muscle aches or headaches?
Yes, actually I have had some body aches and a bit of a headache, but there's no cough or sore throat, which is what confused me because I usually get a sore throat when I am sick. I also feel incredibly tired, like I can't even stand up for long without feeling drained.
That does sound exhausting, and it sounds like the fever is sapping a lot of your energy. Have you noticed anything unusual that could have triggered it? For instance, any recent travel, contact with anyone who was unwell, or any changes to your diet or routine?
I haven't travelled recently, and I can't think of anyone I know being sick. I did help my friend move some old boxes last week, and there was quite a bit of dust and mould in the garage. I felt fine afterward, though.
That's good to know. Sometimes mold or dust exposure can cause respiratory symptoms, but without a cough or sore throat, it might not be related. And are you currently taking any medications or supplements?
No, none at the moment. I usually only take vitamins, but I stopped them a while ago.
Right. Let's start by checking a few things: your pulse, blood pressure, and a quick temperature reading here. Your pulse is slightly elevated, and your temperature is still a bit high at 38.1 degrees. This tells me that your body is still actively fighting something off.
So, does that mean it's something serious?
Not necessarily. Fevers are often the body's way of responding to infections or inflammation, even if they're mild. Sometimes a viral infection causes symptoms like you've described, including fatigue and body aches, and it may pass on its own in a few days. But there are other causes of fever that we need to consider too.
Should I just keep taking paracetamol then?
Paracetamol can help reduce the fever and make you feel more comfortable, which is fine. Just make sure you're following the dosage guidelines. I would also recommend drinking plenty of fluids and resting as much as you can. Fluids help with recovery, and rest is essential for healing.
I have been drinking water, but my appetite's gone. Is that normal?
It's actually very common to lose your appetite when you have a fever. Try to eat small, light meals when you can, but don't force it if you're not hungry. Focus on staying hydrated. Clear broths, herbal teas, and diluted fruit juices can all be good options.
Do you think I might need to go to the hospital?
Not necessarily at this point. If the fever lasts longer than 5 days or becomes very high above 39.5 degrees, if you experience additional symptoms like difficulty breathing, a rash, or severe pain, then you should seek immediate medical attention.
And is there any way to find out what's causing it?
Yes, if your symptoms persist, we can run a few tests, including a blood test, which could show if your body is fighting a particular infection. We could also check for common viral and bacterial infections that sometimes lead to fever. But for now, let's give it a couple more days and see if the symptoms start to improve.
All right, doctor. I will keep an eye on it.
That's a good plan. And remember, call us if anything changes or worsens. Fever can sometimes feel quite overwhelming, but as long as we keep monitoring it, you should be on the safe side. Take it easy, Mrs. Evans, and rest up.
Thank you, doctor. I will try.
You're welcome. Get some rest, and hopefully, you'll be feeling much better soon.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a GP discussing with a sleep specialist. Now read the question.
I wanted to consult with you about a patient experiencing chronic insomnia. He's been struggling with it for several years and hasn't seen any improvement.
Ah, insomnia that's resistant to both therapy and medication?
Exactly. Behavioral therapy didn't work, nor did the prescribed medication.
I see. Did you observe anything significant about his lifestyle that could be affecting his sleep?
Not specifically. He leads a fairly regular life without significant stress.
That's interesting. I've noticed that sometimes underlying health conditions, such as sleep apnea or restless leg syndrome, can go undetected and exacerbate insomnia. Perhaps an overnight sleep study could reveal more.
That might be helpful. I'll recommend that as the next step.
Now look at question 26. You hear an intern reporting to an orthopedic surgeon. Now read the question.
He reports swelling and instability in the knee but no visible deformity. He has difficulty bearing weight and describes occasional locking sensations. The injury occurred 2 days ago, and he's been icing it since then.
What do you recommend as the next step?
Based on the patient's symptoms and history, I recommend an MRI to assess for potential ligament damage, especially considering the instability and locking of the knee. This will help determine whether surgical intervention or physical therapy is required.
What are the common findings in sports-related knee injuries like this?
Common findings include ligament tears, meniscal injuries, or cartilage damage, depending on the mechanism of the injury.
Now look at question 27. You hear a pediatrician's perspectives. Now read the question.
Well, it has always been my goal to work with children and build strong, supportive relationships with their families. I truly believe that understanding a child's family environment and history allows me to make a lasting impact on their health and well-being. Running a pediatric clinic comes with its own set of challenges, including hiring the right staff, organizing the clinic's day-to-day operations, and ensuring we have enough resources for every patient. But I quickly realized that balancing patient care with the clinic's financial health is the hardest part. There's a constant struggle between giving each family enough time to address their concerns and seeing enough patients to keep the clinic sustainable. I am currently thinking about expanding the team to share some of these responsibilities, which I believe is essential too.
Now look at question 28. You hear a pharmacist clarifying with a doctor. Now read the question. Sorry to interrupt, Dr. Wilson. I just wanted a quick word about Mr. Lee's prescription. The one for amlodipine that you prescribed a couple of weeks ago.
Ah, yes, for his high blood pressure.
Right. So he's been taking 10 milligram tablets daily, as instructed. The thing is, he was in the pharmacy today, and he mentioned that he's been having some dizzy spells and feels faint occasionally. It seems his blood pressure may be getting too low.
That can happen, unfortunately. Maybe adjusting the dosage could help manage that.
Okay. I will explore some adjustments, and then I will confirm the changes with you.
Sure, sounds good. Thanks.
Now look at question 29. You hear a nurse talking to her colleague about whether it's appropriate to give a patient medication to help them sleep better in the hospital environment. Now, read the question.
Mr. Lawson has really been struggling to get any decent rest.
I know, and he's mentioned how the noise here keeps waking him up throughout the night.
He does have a lot of trouble drifting off, and every time he stirs, it takes him ages to settle back down. But that doesn't mean medication is the right option.
He's really worn out, and I think he just needs a solid night's sleep. We want him to recover, after all.
Absolutely, but we can't risk him becoming dependent on sleep aids. Even if he's tired, I really think it's best to explore other ways to help him sleep better.
I am happy to sit with him or bring in some earplugs if that would help.
I would actually prefer that over medication for now. We don't want him relying on it when he's not used to it.
Now look at question 30. You hear two nurse managers discussing ways to improve staff morale on their unit. Now read the question.
Several team members. It seems that the stress levels have been exceptionally high lately, and it's starting to affect everyone's morale.
I've noticed that too. We have been dealing with staffing shortages and increased workloads for weeks. We really need to focus on team building and creating a more supportive environment.
Agreed. But the tricky part is finding time to work on these improvements. Have we organized any workshops on stress management or communication skills recently?
No, it's something I wanted to discuss with you. I think we need to make it a priority, but it's been hard to schedule anything with the current demands. Maybe we can delegate some of these responsibilities or adjust our schedules.
That's a good idea. And maybe we could set aside a time each week for team check-ins. I will bring it up with the director and see if we can start with small steps.
Definitely. Let's try to move on this before we lose more staff. High turnover will only make things worse for everyone involved.
I will get on it right away.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42nd, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an interview with Dr. Rennie Singh. You now have 90 seconds to read questions.
Hello, Dr. Rennie Singh. Dr. Singh is a consultant pharmacist and associate lecturer at the University of Southgate, specializing in medication management in healthcare. We're pleased to have you with us today to discuss the importance of medication management. Let's start with why this has become such a critical topic in healthcare.
Thank you, James. I am delighted to be here. Medication management has gained much attention in recent years because of its role in promoting patient safety. While medications have become more sophisticated and targeted, the potential for adverse effects remains a significant concern. For many patients, especially those with chronic conditions, managing medications can be complex. In fact, studies show that as many as 50% of patients do not take their medications as prescribed, which can have serious implications for their health outcomes.
That's an alarming statistic. Can you share what some of the primary challenges are when it comes to medication adherence?
Absolutely. There are a few key challenges. First, there's the issue of polypharmacy. This is common in patients with multiple conditions who may be prescribed several medications. Remembering the dosage and timing for each medication can be overwhelming. Side effects also pose a challenge. For instance, if a patient experiences nausea or dizziness as a side effect, they may stop taking the medication altogether without consulting their healthcare provider.
So, what measures are being taken to help patients adhere to their prescribed medications?
Healthcare providers are increasingly using patient-centered strategies. This includes educating patients about the importance of their medication regimen and addressing potential barriers. Tools like medication calendars, pill organizers, and reminder apps have also become common. In addition, there's a shift towards simplifying regimens wherever possible, such as prescribing medications that can be taken once daily instead of multiple times.
You mentioned side effects as a barrier to adherence. How can patients be supported in managing these?
Managing side effects is crucial for ensuring adherence. One effective approach is setting up a follow-up schedule, either in person or virtually, where patients can discuss any concerns with their provider. This allows for potential adjustments in the treatment plan, whether it's reducing the dose, switching to an alternative medication, or adding a supportive medication to counteract the side effects. Empowering patients to communicate openly about side effects is key to finding solutions that work for them.
That makes a lot of sense. What role does technology play in helping people manage their medications?
Technology plays an increasingly prominent role. There are now numerous apps and devices specifically designed for medication management.
Some apps provide reminders and track adherence, while others allow patients to note any symptoms or side effects they experience. For patients who may not be as comfortable with technology, simple text reminders can still be very effective. The important thing is to choose a system that fits the patient's lifestyle and comfort level.
How do you see the future of medication management evolving?
In the future, I believe we will see an even more personalized approach to medication management, where treatment plans are tailored based on individual patient data. With advancements in pharmacogenomics, we will be able to predict how a person will respond to certain medications, which could reduce side effects and improve adherence. Additionally, as digital health tools advance, we will likely see more integrated systems where medication data can be shared across platforms for seamless communication between patients and providers.
I see we have a few audience questions.
Extract 2. Questions 37 to 42. You hear a radiologist discussing the latest technological innovations. Now, read the questions. You now have 90 seconds to read questions. Thank you all for having me. My name is Dr. Kelly Preston, and today I am excited to discuss the latest technological innovations in radiology and what they mean for the future of our field. Radiology is undergoing significant changes, largely fueled by advancements in imaging technology, artificial intelligence, and new, more personalized approaches to patient care. One of the main drivers behind these changes is the shift toward real-time imaging. Patients, clinicians, and medical researchers now expect quicker and more accessible results, which demand improvements in imaging speed and quality. To meet these needs, the development of high-resolution, low-dose imaging technology has been prioritized. These advancements allow radiologists to produce detailed images faster and with less risk to patients. For instance, certain advanced MRI scanners can now provide high-resolution images in a fraction of the time it used to take. This not only benefits patients by reducing their time in the scanner, but also increases the radiology department's efficiency. Another major trend is artificial intelligence, or AI, which has already begun transforming our daily operations. One of the areas where AI is having the most impact is in the early detection of diseases. For example, AI algorithms have been developed to analyze mammograms and can identify abnormalities more accurately than the human eye. Sometimes years before symptoms even appear. This early detection capability is life-saving, especially for conditions like breast cancer, where early intervention can make a significant difference in outcomes. Beyond diagnostics, AI is also helping to optimize imaging protocols. Algorithms are now able to determine the best sequences for MRI scans based on a patient's specific characteristics, which helps streamline the scanning process. A similar application of technology that's creating a buzz in the radiology field is the concept of radiomics. Radiomics involves extracting a large number of features from medical images using data characterization algorithms. Essentially, This technique allows us to analyze and quantify data that might not be visually observable, giving us deeper insights into the underlying biology of a disease. Radiomics can, for example, help differentiate between aggressive and non-aggressive types of tumors, guiding treatment planning in a more personalized manner. The next major development I want to discuss is the expansion of interventional radiology. Historically, radiology focused primarily on diagnostics, but interventional radiology, or IR, is now at the forefront of offering minimally invasive treatment options. These procedures use imaging guidance to perform treatments, such as biopsies, ablations, and vascular procedures, without needing large surgical incisions. A growing number of hospitals are developing dedicated IR departments, staffed with specialists trained in these procedures. What's driving this growth? Patients and clinicians alike see the benefit in treatment approaches that reduce recovery time, infection risk, and hospital stays, and IR delivers on all fronts. Of course, with all these advancements come challenges, particularly when it comes to data security, as we move toward digital solutions and cloud-based storage for medical images. Ensuring data privacy and compliance with regulations such as HIPAA becomes more complex. Breaches in security could compromise sensitive patient information, making data encryption and secure storage solutions an absolute necessity. The radiology field has recognized the importance of addressing these challenges, and many institutions are now investing heavily in cybersecurity measures. However, the demand for better security protocols is only expected to grow as digital imaging continues to evolve. Finally, the role of radiologists is evolving. With technology handling more of the routine analysis, radiologists are stepping into more consultative and collaborative roles within healthcare teams. In fact, there's a growing expectation that radiologists participate directly in patient care, offering insights that go beyond what's seen in the images. This shift toward a more patient-centered approach aligns with the broader trend in medicine toward personalized care. As radiologists spend more time interacting with patients and clinicians, they become integral parts of the patient's healthcare journey. Helping to interpret complex imaging results in a way that is understandable and actionable. Looking ahead, it's clear that the future of radiology is promising, though it will require us to adapt continually. Whether we're talking about AI, radiomics, interventional procedures, or data security, the field is pushing forward at an unprecedented rate. Radiologists have the chance to lead in this space, embracing innovation and helping shape a future where imaging not only diagnoses, but also directs patient care. As technology advances, our role will undoubtedly expand, demanding a balance of technical expertise, patient-centered skills, and collaboration with broader medical teams. Thank you for your time today, and I'm excited to see where this journey takes us in the coming years. That is the end of Part C. You now have 2 minutes to check your answers.